Physical therapy. That's the topic today. So, the definition of physical therapy is the treatment of disease, injury, or deformity by physical methods such as massage, heat treatment, and exercise. A more detailed definition of physical therapy is an exercise treatment for patients who have been immobilized or impaired in their movements and flexibility. Based off of your own injuries or impaired movement, that's basically what we're looking at as far as physical therapy is concerned. This is according to spinehealth.com. So, you must know that physical therapy has been put into the health and wellness world for a reason. Okay, so to get you functioning and to get you moving at 100%, that's what you want to do. You want to move around at 100% level, and you want 100% level of health. So that's the reason that physical therapy has been placed into medicine, into health and wellness, and this is the reason that your local doctor or your family physician may take a look at a look at what's going on with you, your limbs, your body, and may say, okay, you know what, we're going to do some physical therapy. So yeah, that's the main focus, to get you functioning at 100% of physical health. So now we're going to dig a little bit deeper and talk a little more about physical therapy, because there are different divisions of physical therapy, or different categories, so to speak, of physical therapy. So I want to let you know a little more about that. So just as the medical field has various types of surgeries, there are also various types of physical therapy. So first and foremost, there are orthopedic physical therapists. So you got physical therapy for the lower body, the legs, the knees, the ankles, the feet. That's a big thing. A lot of people are in need of physical therapy for the lower body, for the legs, for the ankles, for maybe the hip joint, lower back, the knees, the feet. You need this. You need this. And if you have been told to go to physical therapy for your lower body, go ahead. Go ahead and get it done, and you're going to feel much better. There's also pediatric physical therapy for children. And that age range, it goes from birth all the way to 21 years old. Wow. Yeah, that's something I didn't know. After doing my research on that one, I didn't know that a pediatric physical therapist can go all the way up to age 21. So yeah, if you think you're grown and you're only 20 years old, and guess what? You're going to a pediatric physical therapist. But yes, if you're hurt and you're a younger person, go to physical therapy if the doctor tells you to go, because it will help your healing process, and especially if you're under the age of 18, it's going to help your healing process and your bone process, as far as your growth and getting your bones to grow and heal up properly. You want to be healed fully physically, so that there's no ailments or deformities coming with your bone structure or your joints because you got hurt and you didn't go to physical therapy. So make sure to go. We also have physical therapy for neurological conditions. So that's with your nervous system. That's with the nervous system. So if you get injured and there's some nerve damage, yes, you would need physical therapy for your nerve damage. And a lot of times that can be painful, but it can be also a lot of numbness, and then loss of, dexterity, or loss of use of a certain limb or fingers or toes or something of that nature, because there's nerve damage and you probably can't quite feel the area that is injured. That's when you have to go to physical therapy for your neurological condition. And that's a good thing, because you want to go in and get yourself treatment, and learn what's going on with that affected area, so that your physical therapist will work with you every single session and show you how to get your nervous system back acting correctly, and give you more movement, and just make you more vital and lifelike. You don't want to You don't want to have areas on your body that you can't really feel. You can move it, but you can't feel it. And you can't move it fully due to trauma or an accident or injury. So go to physical therapy for that. So there's also geriatric physical therapy. That's for aging adults with osteoporosis or arthritis or even cancer or joint replacement and even balance disorders. So sometimes an aging adult could have balance issues and is prone to falling. And to avoid multiple falling accidents, they're referred by their family doctor, their physician, to go strengthen their bodies with physical therapy. That's very important. Very, very, very important. I've come across a lot of people in all around sports fitness, young and mature. I wouldn't say old, I would say mature. Even mature adults, once they are strengthening their body, strengthen your lower back, strengthen your legs, your glutes. It's very important to strengthen your body to avoid falling. Even young people fall on ice, and they fall because they're weak too. They need to strengthen their bodies. A lot of times, the way that you're able to catch your body, if you almost, like, let's say you're walking and you slip on some ice, and that is terrifying for a lot of people. And you're walking, and then zip, you slip on ice. Well, for some people, if they have a little bit of strength and they've been working on their core strength, their leg strength, they may be able to catch themselves after slipping on that ice. But for many others who do not train their bodies and strengthen their bodies on a regular basis, that fall could be, it can create an injury. And injuries from a ice fall, from a slip and fall of ice, whew, they're normally pretty serious. So yeah, especially if if you are in need of geriatric type of physical therapy, you're an aging adult, a mature adult, make sure to get yourself physical therapy if you have been told by your doctor to go do that. It's not, I'm going to just give you my expertise opinion. I wouldn't say it's very wise to ignore physical therapy once the doctor has told you to go get it, because it's going to help you. All right, it's going to help you. Now, there's also cardiovascular and pulmonary rehab physical therapy. So that's for those who, you know, it's extremely important. Those who have had, pulmonary embolisms, those who have had heart conditions, that can be a serious issue. And if you need physical therapy or you need rehab, which will help your heart and those areas to heal, do it. Go ahead and do it. Get yourself healed up fully so that you can get a clean 100% bill of health from your doctor. And your doctor could say, oh, you went to physical therapy. Good job. I checked you out. Everything looks good. Perfect. Because, there's people who specialize in helping you to feel better. Once you've done physical therapy, then you can move forward with your everyday life. You've been referred for a reason. And especially if your insurance covers it. Because I know cost is a big ordeal for everyone. Unless you're walking around a billionaire, cost is a big ordeal for everyone. And if your insurance covers your physical therapy, go ahead. Go ahead and do PT. A lot of people in the field, they call it PT, but go ahead and do it. Get it done so that you can correct whatever is physically wrong. I cannot begin to even just tell you. I've told you so many times, but I have to tell you again. There are people that have walked into the doors of all around sports fitness hurt, and they skipped out on physical therapy because they felt that they didn't need it. But that's why they're still hurting and they're still battling with specific ailments with their bodies because they skipped physical therapy. Make sure to listen to your doctor on this. Get it done. Get it done. You will move and feel so much better. Many physical therapists, they'll set you up for in a span of 4 weeks at a time. Maybe you'll do one session a week for 4 weeks or 2 sessions a week for 4 weeks, or 3. Normally, if you get up to 3, most people, that's after surgeries and you're really trying to get the movement and the strength back into the affected area. But do it. Get it done. It can be frustrating, but go ahead and do it. It is not going to hurt you. It's going to help you. It is going to advance you. And, there's other treatment it's helpful to get other treatment to get you back at it. So the heating treatment, the massages, the ice treatment, it all helps with the healing process. So do it. Then you can get back to your physical everyday life. But you got to make sure after that to start working out and training at least 3 to 5 days out of the week. Now, 5 would be what you really need to keep yourself fully healthy. 3 would be maintaining what you have. So if you're someone who needs to get in shape, 3 days is not enough. I'm going to tell you again. If you're someone who needs to get in shape, 3 days a week of working out is not enough. You have to at least work out 5 days a week to get yourself in shape. After you get in shape, then you can trickle it down to 3 days a week just to maintain what you have. Or you may even get used to that type of a healthy lifestyle and you may stick to 5. And you want to at least work out 30 minutes per day. 30 minutes a day is what you want to do. 5 days a week, 3 at the minimum, but 5 days a week. Eat healthy, eat a healthy, balanced meal plan. So 3 servings of vegetables per day, 2 servings of fruit per day, and then you can get in your lean protein, your chicken, your fish, I guess if you need red meat, I cannot. I cannot. But yes, your chicken, your fish, preferably very lean meat for yourself, lean protein. And if you're a person that doesn't eat any animal meat at all, then go ahead and get your iron and your protein from beans. Nuts. Nuts is another good way to get your protein in. So there are other ways to get protein other than just animal flesh. Okay, and yes, 2 to 3 servings of fruits and vegetables per day. That is going to get you back in a healthy state, in a healthy fashion. And remember also, 64 ounces of water per day at the minimum. 64 ounces of water per day at the minimum. Or you just take your body weight, divide it by 2. That number that you get, that's the amount in ounces that you should drink per water per day. Okay? Bells, what's up?
Hey, let me turn my mic on. Hey, girl, I just had a car accident.
Oh, snap. Yeah.
Yeah, and so I ended up in physical therapy.
Yeah.
But in another life, don't tell anybody. I was a medical auditor, so I worked at a physical therapy clinic.
Oh, wow.
Yes.
What is some of the stuff that you saw there?
Oh, my gosh. You know what? I mean, now, the outpatient rehab that I worked at had everybody from, they did physical therapy, they did the occupational therapy,
Okay.
all of those things,
Nice.
Speech therapy as well.
Oh, wow.
Yeah. And
so when a person needed speech therapy, would that come from a stroke or something of that nature?
You know what? It depends on what happened. Sometimes there are car accidents that totally can,
affect your ability to speak correctly.
Yeah.
Wow.
And so it just depended on what happened, and what their, what their path was.
Yeah,
sometimes speech therapy is something that can be a child that isn't,
speaking quite
correctly, or in the case of my brother, he had a stutter.
Oh,
and so he went for speech therapy.
Wow.
So it just depends,
Did you ever sit in on any of those sessions just to see what they
No,
would teach?
I was too young. I was too young when it was going on.
You're go to your session.
Yeah. I knew that he did it, and I never knew him to stutter, but apparently when he was younger he did.
Mm-hmm.
But by the time I started coming along and paying attention to things, he was all good.
Oh, nice.
Yeah, so he.
So it didn't take long to get the speech right.
Yeah, I don't know how many years it took, but
Wow.
he did it for a while.
That's interesting.
Because he had it was something, an imbalance in his hearing or something
Oh.
like that caused. Yeah.
That caused the stuttering.
Right. So he was able to, through therapy, and I mean, he still had little, stutters here and there, but, not to the magnitude. Apparently, he was like really bad with it.
Wow.
But not to the magnitude of,
Yeah.
So
that's interesting.
That is interesting, right?
Because I would have never thought that you would just go to speech therapy to end stuttering. I didn't know what what a person would do to end stuttering. So that's interesting.
Right. Yeah.
That's interesting.
Yeah. I mean, different routes for different people, but that's
for sure.
Yeah. That's
wow.
That's what he did. Yeah.
Wow.
Yeah. So when I was working at the clinic in California.
Yeah.
Long before I became a Wisconsinite.
Oh, man.
There were lots of people and lots of different reasons that they might take speech therapy.
Okay.
Mm-hmm.
That's interesting, Belle.
And then you had everyone there, from those that were taking speech therapy coming into the clinic, those that were working on physical therapy.
Okay.
So they might have been in car accidents or... then you had occupational therapy, people that might have had slip and falls at work and they had to learn to do their job again, right?
Wow.
Yeah. So, so there's a lot of variations and stuff like that.
Yes, it is.
Yeah.
It's a vast field.
Yeah, exactly.
It is a vast field.
Exactly. And, just recently having, people don't know from behind the scenes. That's why it's always good to listen to these podcasts, right?
Yes, that's
because
right.
You find out things that you don't know.
Yeah.
And I was in a pretty serious car accident about a month ago.
Yeah.
A little bit more than a month ago, maybe 2 months now. I don't know. No, it's been like 2 months.
I'm glad that you're okay.
Yeah, but I did end up having to do some physical therapy.
Yeah.
Because there are some parts of me that just, you don't feel the impact right away.
No. And especially if it's not a searing, shooting pain.
Right.
If you don't really feel that and you feel some discomfort, you're just like, oh, it'll wear off. I'll be fine.
Yeah, what's interesting? I got burned by the airbags.
What?
Yeah, I got burned by the airbags on one of my legs.
Oh.
And I guess I was in such shock from the accident that I didn't...
You didn't feel it?
Feel it, no.
Wow.
And the only thing that, when I got home that evening, and I had mentioned it to the ambulance, the paramedics.
Sure.
And they were like, oh, let's take a look at it. I was like, no, I'm sure it's fine. I'm just feeling, it's just me, I'm just freaking. And they were like, you sure? Because they really wanted to take me to the hospital, because if you saw the car accident pictures, you would be like, oh my gosh, all airbags, really? And I was like, no, I'm sure it's fine. I got home, took off my pants, girl, blood all down my leg. It was like, and it was just like a burn, yeah. Yeah, so I went to urgent care next day. They put a little dab on it and whatever, and we were good. But
still, it's shocking to know that, certain trauma and blows to the body. You're like, I'm fine.
Right.
Because your brain is telling you're fine.
Right, because your adrenaline, that's what the ambulance, the paramedics were telling me. When you get home, really take inventory, because we really feel like you should, at least spend the night in the hospital. And I was like, no, I'm fine.
I'm not going to front bells. That would be me. I'm like, I'm not staying in a hospital overnight, especially if I'm able-bodied, I can move. I'm walking the body.
I was like, no, it's good. They're like, okay, so really take inventory of yourself tonight, and when you get up in the morning, and you're really going to feel it in the morning, this and that, but really take an inventory, because you might need to go to urgent care tomorrow. And,
I can understand that.
It was something, but I ended up in physical therapy. It wasn't until days later that I realized that there was something wrong with my other knee.
Wow.
But my doctors were concentrated on the tightness in my neck and my back.
And you're like, also my knee too?
I was like, and I physically realized.
And they're all up here, you're like, and
I
here?
did not pay attention to right? The neck and all that.
Yeah.
You know, I could barely even move my neck. I wasn't paying attention to it though. I was paying attention.
That was some real inflammation.
Yeah, no, my knee was throbbing though, girl. My knee was throbbing,
bet.
and so then I ended up in physical therapy. But you just never know. So everybody, pay attention to your body.
Yes.
Pay attention and take it easy. If you get into one of these accidents, take it
Rest.
easy, because you don't know. I was just like walking around like doo doo doo.
Yeah,
you know,
they'll
like,
be going out to the clubs, you know,
Right.
like, girl, we about to dance for 2 hours. You're like, you may not want to do that. Just rest.
Yeah, they kept telling me that, but I kept going. I went out at the club, but I kept going, and you know,
Yeah.
you really have to. What you say is so true, Shannon. That
Yeah.
you have to, you know, take inventory.
Yeah.
You have to pay attention
Mhm.
and do what your doctor says.
Yes,
You
you
know.
have to listen to your body. It's very important. It's very, very, very important. And physical therapy is there for a reason.
It sure is. It sure is.
So do your physical therapy. That's what I have for All Around Health.